Dr. Clark, thank you.
Hi. Good afternoon. Thank you for accommodating this little change in schedule. I'm supposed to catch a plane at 4 o'clock to go see my little grandbaby, and I know you wouldn't want me to miss that. All right. So I'm here to talk with you about some of the communication and swallowing difficulties that you might have and give you some ideas for how to manage them. So if you think about all the things that have to happen for us to have a conversation, just to exchange some information, first we have to have an idea, something we want to communicate. We have to put that meaning into words somehow. Those words have to be translated into movements, and then the movements themselves must be carried out accurately. So any one of these points along the way, things might break down and make it difficult to communicate, even on the way in. So we have to hear the sounds, we have to recognize words, and then we have to understand what those words together combine to make a message. So when the problem is at the level of idea, we tend to call that area cognitive difficulties, and that would include difficulties with memory, attention, decision making, and it can affect both your ability to think about what it is you want to say, but also understand what other people are telling you. With respect to communication, difficulties at this cognitive level can affect some subtle aspects of communication too, things like using and understanding facial expression and tone of voice, or even being able to stop yourself from saying things that you wouldn't otherwise say. When the difficulty is at the level of language or where the words are being processed, we call that term aphasia. And that kind of difficulty makes it difficult to understand specific sounds and words. The most common complaint is not being able to think of the word that you want to say. Sometimes the wrong word comes out instead. And for some people, even the grammar can be disrupted. And again, that can affect both your production of that, but your comprehension of it as well. When the difficulty is at the level of the instructions for the muscles, we call this apraxia of speech, and it's actually very common in PSP. How this affects speech is that speech becomes very slow and effortful, and pronunciation tends to be particularly challenging. The instructions for which sounds go where and how to make those sounds in a smooth movement becomes very difficult. And then if everything up to that point has gone well, but the muscles and nerves can't carry the correct message through, then we get a problem that's called dysarthria. And that's kind of that classic slurred speech that you have heard. For some people, it makes the voice very soft. The speech can sound mumbled and even faster or slower than usual. So it turns out any of those areas could be affected in the conditions we're concerned about today. Sorry, I think I went ahead and said that just all of them can be affected. So I didn't want to talk them through. So what you might want to know is if you're experiencing any of those difficulties, could therapy be helpful? And the short answer is yes. But the longer answer is, what might that therapy look like? So certainly there's a role for a more traditional type of therapy where you might come to a clinic, learn some specific skills, practice them, identify ways to build those strategies into your life, and then troubleshoot if the strategies you've selected aren't really helping the way you hoped they would. So there's definitely a role for that. But another approach to taking advantage of the resource of a speech-language pathologist would be through periodic reconsultation. And that's very typical of how we do this at Mayo Clinic. But instead of having twice a week therapy on and on and on, you might visit with the speech pathologist once every several months. They can reevaluate, see where you are struggling now, and give you brand new suggestions for moving forward. So what I have prepared today are just some suggestions for managing communication difficulties, like, you can take these with you today. So the ones I'm going to emphasize are called comprehensibility strategies. Comprehensibility, probably not a word you use a lot, but it refers to our ability to exchange information, make sense of a message, no matter how it is conveyed. So it's basically, did you get it? Not, was it enunciated perfectly, or did all the words come out in the right order? And what is important about comprehensibility is it is not just something that the speaker is responsible for, but it's also influenced by the skills the listeners bring, and even how the environment is shaped. So I'm going to talk about things you can do to the environment to make it most conducive to communication, things the speaker can do, and things the listener can do. So the first thing I would suggest about the environment is just be in the same environment. That is, don't talk to each other over a distance. I always end up saying this, but we go our whole lives developing very, very bad communication habits because we can get away with that. We actually will shout from one end of the house to the other. We'll have one of us at the sink and one of us at the dishwasher, and we'll try to talk to each other while we're facing away. Just doesn't work very well. So just being in the same environment, call the person's name, go to them, or wait for them to come to you, then say your message. Distractions are something that are just ubiquitous, and again, we go through most of our lives not being bothered by them, but when communication becomes very challenging, then you need to, then even a small distraction can take away from the resources you need to be processing communication. And so I mean both auditory and visual. Mute the TV, have your chair facing away from where most of the action is, that kind of thing. And as I just mentioned, don't multitask. When it's time to talk, talk and listen. And choosing the time and place for communication, probably, if you're in this room, you have figured out that communication actually has to be intentional. And you probably want to save the most important conversations for when communication is going to be most effective. So when you're at your best in the day, not at your worst. Some things the speaker can do to make their speech easier to understand. I'm going to very quickly, some of these focus on speech, that is how you're saying it. Some of them focus on language, that is what you're saying as opposed to how you're saying it. And then communication focus. So what are you doing while you're trying to communicate that can help people understand you? So my first and last suggestion, what I mean by that is it's the strategy that works when speech is only mildly impaired, and it's the strategy that works when speech is severely impaired. And that is to speak slowly. And if your speech is terrible, speak very slowly. This technique in particular will work even when speech is very, very, very impaired. What you want to do is pause briefly between each word. Pay attention to the smaller words. Don't separate syllables, but just include every syllable. And try to use intonation like I was doing right there. I tell people is part of this helps because the speaker can have a little extra time to program movements as they need. But that's probably just a small part of how this works. I think the main thing is it gives the listeners more information about where the word boundaries are. So we can hear that you said one 3-syllable word instead of 2 smaller words, and then our brains can figure out what you said. And I'm not going to play that video because I just demonstrated it for you. Okay, so you've done your best, you've slowed way down, but somebody didn't understand anyway. So my suggestion is the first time somebody asks you to repeat it back the exact same way you said it the first time, because then all the person has to do is find the words that they didn't catch. Whereas if you change the message entirely, now they have to catch every new word again. But if it doesn't work after you've said it twice the same way, then say it a different way, but just kind of signal or have a signal, yeah, I'm doing something different now, so that we're not trying to put it back into that puzzle. It's very important to get the listener's attention. I mentioned call out their name, wait until they're looking at you or even in the same room with you before you start talking. And then finally, we want you to use all the modalities that are available to you. And most of us do multimodal communication most of the time, but this now can be more intentional. And importantly, don't underestimate the importance of using these other modalities. Point to things, write things down, gesture, facial expression. If you're the listener, the first thing you should do is make sure that you're actually paying attention. As I mentioned before, when conditions are ideal, we can listen without much attention, but these won't be ideal conditions, and you're going to have to tune in to get the message. And then I always suggest avoid the least helpful question in the English language, which is, what? Because when you say it, and guilty, okay, just do as I say, not as I do. When you say that, the speaker has no choice but to say the entire message again. But you might have actually caught some of it, so what is better is to repeat back the part of the message that you got. You want to go where after work, who called, and then the answer that they can give is usually shorter and fewer options, and so you're going to be more likely to understand it. And ask questions, sorry. All right. I'm going to quickly switch gears and talk about swallowing. As you know, swallowing is not, again, it's one of those automatic tasks that you don't give any thought to until it's not working. The difficulties that many people experience when swallowing is affected is coughing and choking with liquids. If you haven't learned already that liquids are most likely to be difficult, you probably will find out soon. It's not the chewing and swallowing so much as those liquids going the wrong way. Sometimes people will take too much in either liquid or solid for them to be able to manage. Chewing tends to be slow, and sometimes it takes several swallows to get food completely out of the mouth and through the throat. If you haven't ever had a chance to think about this, the trick with swallowing is that we've got two systems that are overlapping. So we have the respiratory system tract that goes from your nose down to your lungs, and then you've got the alimentary canal, or the swallowing mechanism, mouth to your stomach. And they overlap there in the pharynx or the throat. And so it actually requires precision timing to not swallow air or breathe food. So here are my suggestions for how to manage these difficulties. So just in general, avoiding distractions. I don't know how many people were listening over lunch, but in this kind of setting in particular, there's lots to talk about, people going in and out, lots of distractions. I actually heard quite a bit of coughing during lunch. And again, it's just because some resources were diverted away from the motor system momentarily. Our mothers told us not to talk with our mouths full. Turns out that was right. But again, you don't want these muscles that are busy trying to swallow doing something different at the same time. And another important suggestion is to clean your mouth before and after eating. This might not be obvious why you would do this, but if food goes the wrong way and into your lungs, the lungs have a good several mechanisms for protecting you from either that turning into an infection. But if what goes down there already has some bacteria in it, it's going to be harder to fight that off. Where's the bacteria going to come from? Your mouth. Okay? So you want your mouth to be very clean before you start to eat or drink, and then you want to clean it as soon as you're finished so that there's nothing there to then become full of bacteria. Some other suggestions about foods that you might find easier or harder. I've listed here some of the kinds of foods that you might not have realized or thought about that tend to be difficult. So foods that require a lot of chewing, you probably had that one. But foods that fall apart, like a crumbly cookie or a saltine, something that's hard to keep track of will also be more difficult. Foods that are both a solid and a liquid this time of year, watermelon, okay? But also think about cold cereal with milk, soups, brothy soups. And it's harder for your mouth to keep track of. You don't have to avoid them entirely, you might just have to be more careful. And we already talked about thin liquids. Foods that are easier tend to be safer, or probably all the things you would think about, things that don't require a lot of chewing, things that stick together. And as far as liquids go, thicker liquids do tend to be a little bit easier or cause less coughing and choking. So when you're eating, we suggest taking small bites, swallowing twice, and alternating solids and liquids. When I was growing up, that was called washing it down, and we were all supposed to do it. And it's actually a very good strategy. When you're drinking liquids, you want to keep your head neutral or your chin slightly down. Tipping your head back opens your airway wide open. Remember your CPR class where you're supposed to tip the chin up? Okay, that's the opposite of what we want when you're eating. And so when we are tempted to tip our head back is when we're trying to get to the bottom of the glass, right? So my suggestion for you is only drink from the top half of the glass. Okay? When it gets halfway to the bottom, fill it up again and drink more to avoid this. Or you could use a straw, would be another way to get to the bottom. And as I mentioned, thicker liquids tend to be a little bit easier to swallow. Sometimes pills will be particularly difficult to swallow. My suggestion is put the pill in something like yogurt, applesauce. Some people even like to put it into something more solid, like a piece of bread or a piece of cake or something like that you can swallow without chewing. And then follow that with liquid rather than putting the pill in your mouth and then trying to do the liquid then, because now you've just created the solid liquid conundrum that I mentioned is more difficult. Okay, I think I fell in my timeline, and that allows us a few minutes for questions about communication and swallowing. Looks like we got one right over there.
Yes, mine is about writing. I am supposed to, I had beautiful writing before, and now it doesn't look like anything. I was wondering if there's anything I can do to type something or something.
Sure. I'm going to defer the question about whether there's anything to help the control of your hand to the occupational physical therapists that are coming up next. But as far as using other modalities for written exchange, absolutely. And there are even apps for phones and iPads, tablets, that where if you type the message, it can say it out loud. And so that can even be a mode of communication. Thank you.
Sometimes my wife just simply uses the wrong word. You know, she's enunciating clear enough that I can understand her, but she'll be talking about something like hand me blah blah when she meant something else.
Yes.
So that's just to alert people too that isn't working. A week ago, I was away, and a caregiver I had at the home put her on the telephone. I could understand her.
Yes.
You know, that's just another suggestion. When you're sitting down talking to them, maybe call the person that's sitting across the table.
Yeah. And that works, in case anybody's wondering, that actually is a thing.
Yeah.
But when our brain processes or thinks that the person we're talking to is far away, we automatically raise our voice, which is why many people have that loud telephone voice. But it can help because we know that talking louder is one of the ways to make speech better. So that's how it works.
Then on swallowing, the other problem she has, you didn't really mention, she gorges.
Yeah.
You know,
Yeah.
and
So the impulsivity.
The
Yes.
impulse thing. Yeah.
Yeah. I've talked with some families about only putting small amounts on the plate at a time. So I think as humans, we are prone to taking more when we see more. So if there's less to take from, there might be a little...
Smaller spoons, for example.
And smaller spoons, excellent. Yep. Here's...
I know with the person that I take care of, it's a good friend of mine, what I noticed when she started struggling with swallowing, she does speech therapy, which I recommend to everybody. What the speech therapist said to her was, come before you have a problem. And I've got to tell you, I really give you a lot of credit for all the work that you do. Anyway, what I started researching was how can I help, because it's a nerve muscle issue. Anyway, I started doing exercises with her at home to strengthen the neck and the swallow reflex, and she's had a lot of success with that. So it may be something that you need to fly by your physical therapist or your speech therapist, but there are some exercises out there that can help improve the tone and the swallow. The other thing is when you place the food in your mouth, to use the spoon, the utensil, whatever it is, to make sure you have a gentle pressure on your tongue, because that helps trigger the swallow reflex and then just chewing thoroughly.
Yeah, very good suggestions. And there are more elaborate swallowing strategies than what I shared with you. So that is kind of the kind of thing, as you mentioned, that you might get instructions from a speech-language pathologist. Yeah.
I have read that the part of our brain where we store words that we use for speaking is different from the part of our brain where we store words for singing. And I had tried with this patient that I met in Florida who could no longer speak, which was very frustrating for his care partner because she wanted to speak with him. And I had not tried this before, but I just knelt down in front of his wheelchair and I said, I want to try something with you. And he was very nice. He smiled as much as he could and he said, okay. And I said, I know speaking's hard for you, but we're going to try singing. And I said, no, don't be alarmed. I don't really have a good singing voice. And it's not going to be so melodic, but we'll give it a try. And so and it doesn't have to be a tune, just so that it's musical. So I got sat down in front of him and I said, why don't we sing? And he looked at me and he said, why don't we sing? And I said, okay, that worked. And I said, and I'll see if I can get through this. I said, I love you. And he sang back, I love you. And his wife was crying.
Yeah.
But I have never read this in more than one place. I've only ever tried it one time. Possibly some of you here today could just give that a try. It was it was amazing.
Yep.
And I don't know, in your experience, what you've ever heard about that.
Sure. Yeah, it's actually a pretty well-known phenomenon. You know, when I was talking about all those places where communication could break down, that singing component or adding rhythm or tune can work for aphasia and apraxia of speech. It's probably not going to be super helpful if the main problem is dysarthria or even the cognitive difficulties, but there is some room there for that to be worth trying. So, yeah, thank you for bringing it up.
There was a country singer who stuttered when
Yeah.
talking, but didn't stutter when Mel Phillips.
Yeah, yep.
4th of July last year, there was a military veteran who had severe traumatic brain injury, could not speak, but he sang.
Yeah, it's, the brain is a fascinating animal, isn't it? Yes.
Hi, I'm actually a speech language pathologist too, so yay.
Yeah.
But I work in the educational setting with little kiddos. But what I'm wondering is there a hierarchy of consistencies of food that PSP patients can follow, and when they need to make a decision to move to a different consistency?
Yeah, that's a wonderful question. You know, I think the hierarchy is, it's very common sense. I think if you thought about it, you'd come up with the same answer that I'm going to give you, which is things that are harder to chew would be at the top of that, things that fall apart, then there are lots of normal foods, noodles, cooked vegetables, ground meats. There's a whole bunch of normal foods that are soft, easy to chew, don't fall apart, that would be the next thing. And then it would be being selective among those. And so I think it's quite a ways down the list before you'd probably have to do anything to modify solid consistencies. And I think in my experience, patients tend to make those decisions based on how much effort it is taking them to eat. So when eating this kind of food becomes too difficult, takes too long, then I naturally switch to foods that are easier.
Do you know if there's something on the ASHA website, the Speech Language Association website?
That's a
that would
good
show
question.
That?
I would presume so. I'm not picturing it in my mind right now. But probably, any website that talks about difficulties with chewing and swallowing could kind of lay that out too.
Do you know about any adaptive equipment for any feeding as well?
I'm going to defer that to my physical medicine colleagues in the next talk.
Thank you.
Going back to the apps that you can find, I've been researching and looking. Do you have any that you recommend more than others?
Yes, but it's going to sound like an Apple commercial, and I don't mean it to be. It's just that those are the ones that I know because I have one.
I'm an Apple girl.
Okay, so, but Assistive Express, and if maybe, if there is a mailing list, perhaps what I could do is create a quick email that could be distributed to everybody rather than trying to list them out for you. Would that be all right?
That's
Okay.
great.
I'll do that.
And then the other question really quickly is the phlegm that comes with everything.
Yes. Boy, if we had a cure for the phlegm. That's a very challenging symptom, and I imagine there may be more people in the room who can speak to it, but I'll just tell you the few things that we often suggest. So the phlegm gets thick and sticky when there's not enough hydration. So hydrating well helps keep those secretions thin, but also helps to just move the secretions through the throat. Sorry, I keep doing that. So one of our suggestions is really just sipping liquid throughout the day to get to both of those things. A good throat clear, a good cough before eating to try and clear as much of that mucus out of there before eating is another suggestion.
I've been diagnosed with PSP, and I have that problem of shoveling food into my mouth as fast as possible. And my wife suggested, and it was agreed to by my physical therapist, that I eat with my left hand, and I'm normally right-handed, and simply eating with a smaller utensil with my left hand helped a great deal with that.
I love that idea. Yeah.
We are using at the present moment the Vita and Pen stimulations. What are your thoughts on that? That it's
Sorry, is it vital?
vibrations,
Is it
electrodes,
Is it Vital Stim? Is
Vital
that-
Stim,
Okay.
and then the other one is pens. There's two of them.
Oh, TENS. Is it TENS?
Oh, they
Or
call.
pens?
Oh, it could be tens. It sounds like pens. But
Okay, they may have. It's probably they changed the
Well,
T
they're-
to a P for pharyngeal.
Right.
I'm guessing.
But he used one in Florida and then the other one in Michigan, and I'm wondering,
Yeah.
what are your thoughts on it? Because there's quite the vibrations.
Yeah, so it's a loaded topic, so there would be a lot to review. Basically, it's intending to exercise the muscles when you can't drive them to exercise them yourself. And we think that one of the ways it is effective is less about stimulating the muscles, but just increasing that sensory input in this region. So as far as I know, there is not any study suggesting or that has even begun to look at that modality in PSP, MSA, CBD. But certainly it has been described for Parkinson's disease and other neurologic conditions. So I don't have any reason to discourage it in this population like we might in some others, but I can't say with any certainty that it's, you know, the thing that's going to work better than anything else, but I don't think it can hurt anything. Okay. Sorry, we have run out of time. I want to make sure
We are out
my...
of time for questions.
Oh, okay. Thank you.
Thank you, Dr. Clark. Thank you so much.
Yep.